Now, as health centers continue to cry of insufficient blood supply, the Gambia Armed Forces mobilized troops to various facilities in observance of the World Blood Donor Day. The day is set aside by the World Health Organization to raise global awareness of the need for safe blood and of the critical contributions of donors. Over 200 personnel of the Gambia Armed Forces decided to donate to the Kanifing General Hospital in order to save lives. Details of that in this report. The Gambia Armed Forces blood donation drive took place in all major health centers and hospitals across the country. While the opening ceremony was observed at the Kanifing General Hospital with more than 200 soldiers as donors, similar exercises were ongoing in other facilities including the Edward Francis Small Teaching Hospital in Banjul, Buyam in the West Coast, Farafenni in the North and Basay in the Upper River regions. The intervention is designed to surmount instances of shortage of blood as a major challenge in the health delivery system, resulting in lives lost. Speaking ahead of the blood donation drive on Monday morning, Deputy Chief of Defense Staff of the Gambia Armed Forces, Major General Mohamed Ocham, considered the blood donation as a norm to the Army. He underlined the humanitarian aspect of saving lives, especially at a time when the COVID-19 is posing additional complexities in health service delivery.
As part of this year's activities marking the day, the Gambia Armed Forces is joining the rest of the world to commemorate the day by donating blood to all government health facilities across the country. This patriotic and humanitarian gesture is aimed at complementing the efforts of the Ministry of Health, Social Welfare in ensuring adequate supply of blood to Gambians, particularly during these years of COVID-19 pandemic. Consequently, officers, soldiers, and ratings of the Gambia Armed Forces in all military installations, from Banjul to Basse, would voluntarily donate blood to ensure individuals and communities have access to safe and quality blood and blood products in the normal and emergency situations they face.
The Chief Executive Officer of the Kanifing General Hospital, Keba Mane, emphasized the importance of blood donation in saving the lives of millions of patients across the globe. He thanked the Gambia Armed Forces for the regular and punctual response to the needs of health facilities in the country.
Safe blood and blood products and their safe transfusion forms an integral part of public health care service delivery. They save millions of lives and improve the health and quality of life of many patients daily around the world. The need for blood and blood products is universal, but access to safe blood and blood products for all those needing it is not. It varies greatly across and within countries, and blood shortage is acute in resource-constrained countries, including Gambia.
World Blood Donor Day is celebrated each year on June 14 to pay tribute to all unpaid voluntary donors for their gift while raising people's awareness on the importance of regular donations in order to secure high-quality blood and blood components for use in the healthcare system. Reporting for iAfrica News, I am Mariama Cham.